Good morning. I'm Merlin Shiba, Associate Professor, Department of Community Health Nursing, Bharat Institute of Higher Education and Research, Chennai. So today I'm going to deal about the antidiuretic drugs from the pharmacology subject. First, we'll see what is an antidiuretic hormones. The antidiuretic hormones, also known as commonly as an original vasopressin, it's a 9 amino peptides secreted from the pituitary gland. Within the hypothalamic neurons, the hormone is packed in the secretory vesicles with the carrier proteins called the neurophysin, and both are released upon the hormone secretion called diabetes insipidus. So you can see in this picture, the pituitary gland sends on hormones called antidiuretic hormones to the kidney to help control how much urine is made. So normally, the pituitary glands will send an hormones called an antidiuretic hormones, and this signals will be sent to the kidney where the kidney has to secrete how much of urine. So that will be controlled by this antidiuretic hormones. But the next side you can see the nephrogenic diabetes insipidus. That is because the kidney don't respond to the antidiuretic hormones normally, they make a lot of urines that is called diabetes insipidus. So we'll see what is the definition of the antidiuretics. So these are the drugs that reduce the urine volume, which is mainly specifically used in a condition called diabetes insipidus. So we'll see what is the physiological effect of antidiuretic. The hormone effects on the kidney, that is a single most important effect of antidiuretic hormone, is to conserve water body by reducing the loss of water in urine. The diuretic is an agent that increases the rate of urine formation. The injection of small amount of antidiuretic hormone into a person or an animal, it results in antidiuresis or decreased formation of urine, and the hormones was named for this effect of this antidiuretic drug. Normally, the hormones effects will be there in the kidney, that is an antidiuretic hormones. It is helpful for conserving the body water and by reducing the loss of water in the urine. That normally in the diabetes insipidus, the patients will have a extreme amount of, that is mean more than liters of urine will be expelled out through the kidney. So when you give this antidiuretic hormone for the patient with an diabetes insipidus, automatically it will create an antidiuresis effect, and the hormones effect will be increased, and that will helps to lessen the amount of urine in the patient. The antidiuretic hormones binds to receptors on cells in the collecting ducts of the kidney and promote the reabsorption of water back into the circulations. So automatically antidiuretic hormones first it will be acting in the collecting ducts of the kidney, and where it promotes the reabsorption of water back into the circulation, so that the urine flow will become reduced. If in the absence of antidiuretic hormones, the collecting ducts are virtually impermeable to water and it flows out as urine. Antidiuretic hormone stimulates water reabsorption by stimulating insertion of water channels or aquaporin into the membranes of the kidney tubules. These channels transport the solute-free water through tubular cells and back into the blood, that is leading to decrease in the plasma osmolarity and an increased osmolarity of the urine. Since in the diabetes insipidus, the patient is normally the patient will have a increased amount of urine formation, that the patient will that the patients will have more amount of urine. That is, the patient will have a increased amount of urine formation when the antidiuretic hormones being acted in the diabetes insipid. Automatically, the patient will have a decreased amount of urine formation, and that leads to a plasma osmolarity will get decreased, and the osmolarity of urine will become increased. The more concentrate the plasma, the more the antidiuretic hormone is released in the blood. Whereas the antidiuretic hormone reaches the kidney, it causes them to reabsorb more water. This keeps more water in the body and produce more concentrated urine. That is, when the antidiuretic hormone reaches the kidney, what will happen? It makes started to reabsorb more water, so that the more amount of water in the bodies and produce more amount of concentrated urine. Whereas if the plasma is become more diluted, automatically the antidiuretic hormones is released into the bloodstream, and this allow more water to leave the kidney, producing more diluted urine. This method of control is known as a negative feedback. So you can see in this picture, that is from the hypothalamus, the pituitary gland is secreting the antidiuretic hormones. If the antidiuretic hormone is increased, automatically the body increased antidiuretic hormones, that leads to more water absorption, and they'll have a concentrated urine. The patient will have a more concentrated urine, and the body will become a dehydrated. But if the antidiuretic hormone is less secreted, automatically the less water is absorbed in the kidney, and the you will have a diluted urine, and the body will get lot of hydration. This is what the physiological effect of antidiuretic hormone. And next we'll see about the antidiuretic hormone synthesis and release of antidiuretic hormone. How it is being synthesis and the release. First is stimuli, that is rise in plasma osmolarity and contraction of extracellular fluid. It generates the impulse from baroreceptors, and the posterior pituitary gland secretes the ADH, that is antidiuretic hormone. Hypothalamus nerve cell bodies synthesize the antidiuretic hormone along with the protein neurophysin, and it transport to the nerve ending in the median emions and the pars nervosa. Osmoreceptors, that is a hypothalamus, and the volume receptor is a left atrium, ventricles, and the pulmonary veins primarily regulate the rate of antidiuretic hormones release. And we'll see the antidiuretic hormone receptors. So you have two receptors. One is the G protein coupled cell membrane receptors, and it has two types, V1 receptor and V2 receptor. V1 receptors are except on renal CD cells, ACL LH cells, and vascular endothelium. And it has a subtypes called V1A and V2B. V1A, so it is acting in the vascular, uterine, visceral smooth muscle, and tissues and brain. And V1B is subtypes are mostly responsible for anti-pituitary gland, brain, and pancreas. And the V2 receptor is more sensitive, and the location is collecting duct in the kidney, which is regulating the water permeability. And ACLH cells, it activates the sodium, potassium, and 2-chloride transporter. The vascular endothelium is a vasodilator effect. And what is the action of antidiuretic hormone? This antidiuretic hormones, it has a certain effect on certain parts. One is the kidney. The main action is on the kidney. That is, kidney, it acts on collecting duct cells. It increases the permeability of water, get absorbed the concentrated urine. That is, hyperosmolar urine with same osmolarity of the medulla. And next with the blood vessels, the construction of blood vessels through V1 receptor, and it rises the blood pressure, and prolong the exposure causes smooth muscles and hypertrophy. And next on increase peristaltis evacuation and expulsion of gases, that is on GI tract, and on uterus contraction due to AVP acting on oxytoreceptors. It increases the sensitivity of oxytocin. AVP doesn't penetrate blood-brain barriers, act as a peptide neurotransmitters. It regulation of temperature, systemic circulation, task learning, and this all the receptors. And next is the mechanism of action. How this receptors are become, how it is action is taking place. First, B2 receptor, that is principal cells of collecting duct, that is increased aquaporin expressions leading to increased water absorption, decreased urine formed. The increased vasopressin regulated the urea transporter expression in terminal collecting duct cells and increased the medullary hypotonicity, increased water absorption, decreased urine formed. V1 receptor, it constricts the vas recta, that is, diminish the blood flow to inner medulla. It reduces the washing off effect and helps in maintaining high osmolarity and contributing to antidiuresis effect. What are the classification of antidiuretic hormones? We have antidiuretic hormones has been classified as vasopressin, desmopressin, lipressin, terlipressin, and the other diuretics are thiazide diuretics, amiloride, and miscellaneous are indomethacin, chlorpromamide, carbamazepine. Or these are the classification of antidiuretic agent. And pharmacokinetics of antidiuretic agents or analogs of vasopressin are: one is absorption, next is metabolism, and next is the excretion. So what happened in the absorption? It is orally inactive because it destroyed by trypsin, and metabolism it takes place in the liver, and the excretion takes place in the kidney. Analogs of antidiuretic hormones and analogs of vasopressin. First is lipressin. A lysine analogs acts on both receptors, longer duration of action. Terlipressin, it's a synthetic prodrug mainly used for bleeding esophageal varices. Mostly the terlipressin is mainly used in the esophageal varices, that is the dilation of the vein. Desmopressin is a synthetic peptide selective V2 agonist, 12 times more potent than all of the drugs, but produces systemic side effects which are overcome by the nasal application. Mostly this desmopressin is being used for the diabetes insipidus patient. Next, what are the uses based on V2 action? First, the diabetes insipidus. The diabetes insipidus of pituitary origin, it's nothing but the neurogenic important indication for vasopressin, but ineffective in renal diabetes insipidus. Next is, it is used for bedwetting in children and nocturia in adults. Mostly these drugs are used in the bedwetting. The children who are doing bedwetting, for them we can use this drug so that the urine formation will become lesser in the night time. Desmopressin, it reduces the urine volume, resulting the control nocturia condition. And next is a renal concentration test. That is 5 to 10 U causes the maximum urine retention and the urine concentration. And next for the hemophilia, that is, it is a genetic disorder where missing or defective von Willebrand factor, that is a clotting protein is absorbed, where ADP releases the clotting factors. And next uses will based on the V1 action. Already we have seen this drug has been mostly used in the esophageal varices. So first one is bleeding esophageal varices. Vasopressin stops the bleeding by constructing the mesenteric blood vessels and reducing blood flow through liver and allowing the clotting formation. Second one is before abdominal radiography, that is, leprosine used to drive out gases from bowel facilitates the easy abdominal radiography. Next is the adverse effect. Adverse effect, what are the adverse effect of this antidiuretic drugs or transient headaches? The patient will have a severe headache, flushing and the nasal irritation, congestion, blenching, nausea, hyponatremia and the fluid retention. Next is contraindication. So the mainly these antidiuretic drug should be very contraindicated for the ischemic heart disease, hypertension, chronic nephritis, psychogenic polydipsia, urticaria, and other allergies. All these, and the patient with all these conditions, we have to be very careful in giving this vasopressin drug for this patient. Next is the second derivative is called thiazide derivatives. That is, it has a protoxical effect. Mostly the furosemide is a thiazide diuretics where it has a effective but less desirable. That is, it has a short and brisk action over the patient kidney, and it has an effective in both neurogenic as well as a nephrogenic diabetes insipidus cases. And what is the action of this thiazide diuretics? It is also similar to the salt restrictions, that is, a state of sustained electrolyte depletions, and the glomerular filtrate completely reabsorbed that osmotically in, in the PT, using urine passing as low solutes, that is represented to a cortical DT, and the salt reabsorption decreases, less dilute urine presented to collecting duct, that is CD, same is passed out. Mostly it reduces the glomerular filtration rates that leads to reduced fluid load on the tubules. And the other antidiuretics hormones drugs are amdiuride, indomethacin. The amdiuride is lithium-induced nephrogenic diabetes, the insipidus, the DI. The drug of choice is to reduce the polyuria in renal DI, reduces the renal PG synthesis, combined with thiazide plus amiloride and other NSAIDs are very less active. Chloropromide. It's a long-active sulfonylurea, oral hypoglycemics, and effective in neurogenic DI and sensitize the kidney to ADH, that is antidiuretic hormones. And the next antidiuretic drugs are carbamazepine. That is, it is also has an effect of anti-epileptic, which is more effective in neurogenic DI, and the higher doses needed, but it has some marked adverse effect. And how alcohol and extensive effects are there in antidiuretic drugs. Alcohol suppresses the antidiuretic hormone protection. So this causes the kidney to produce more diluted urine. It can lead to a dehydration in a patient, and ecstasy increases the antidiuretic hormone protection. This causes the kidney to reabsorb the water, and it acts result in the body having too much of water. And what are the diseases involved in these conditions? The most common disease of man and the animals related to antidiuretic hormones is a diabetes insipidus. Mostly, these antidiuretic hormones are more related with the diabetes insipidus condition. It can be either for man as well as for the animals. So this condition can arise from either of two situations. One is hypothalamic central diabetes insipidus, and next is the nephrogenic diabetes insipidus. First, we'll see what is hypothalamic diabetes insipidus. The hypothalamus, that is called as a central diabetes insipidus, results from a deficiency in secretion of antidiuretic hormones from the posterior pituitary. Mostly this hypothalamic diabetes insipidus, it results from because of the deficiency of the antidiuretic hormone, which is from the posterior pituitary. Mostly this disease causes head trauma. When there is a head trauma, or if patient is having any infections in the brain like meningitis or tumors which is involving the hypothalamus, it's called the hypothalamic diabetes insipidus. Next is the neurogenic diabetes insipidus. It occurs when the kidney is unable to respond to the antidiuretic hormone. Mostly, this nephrogenic diabetes insipidus, it has been shown when the kidney is not responding to the antidiuretic hormone. It is most commonly this results from some type of renal diseases. So in certain diseases where the kidney is not going to respond to the antidiuretic hormone, that time you can see this nephrogenic diabetes insipidus. That is, but mutations in the antidiuretic hormone receptor genes or in the gene encoding aquaporin 2 have also been demonstrated in the affected human. And next is we'll see the diabetes insipidus. In this picture, you can able to just we can correlate what the whole condition in this one picture. First, the patient is having a head injury, or the patient is having a pituitary tumor, or the patient undergoing some procedures, surgical procedures like craniotomy. So if there is a patient is having all three, any of this condition for the patient in the patient history, what happened? The pituitary gland, which are going to secrete the antidiuretic hormone, that is going to get affected, and it is going to send a signal to the kidney where it is not going to respond properly, right? So what happened? The signs and symptoms you can see in this small bucket, that is a patient will have 20 liters of urine per day. Imagine the patient's if the patient is excreting, that is there, the patient is going for getting out of urine like about 20 liters to 25 liters of urine out. So definitely the patients will have a dehydrating problem, and the patient will go into a the patient will have a decrease amount of fluid content in the body, that the patient will have into a hypovolemic shock also. The automatically the patient's specific gravity of the urine will get decreased, and the osmolarity will of the urine will get decreased, and the patient will have a hypovolemic shock. The patient will have an increased thirst because the patient is that is expelling the more amount of urine for about 20 liters. So automatically the patient's thirst will be decreased because of the dehydration, and the patient will show the shock signs and symptoms like tachycardia, that is increased heart rate, and automatically the patient will have a decreased BP, that is the blood pressure will be decreased. And what will be the treatment for this patient will be in the sense that we have to give antidiuretic hormones like vasopressin or desmopressin. So these are the commonly drugs that's used for this diabetes insipidus, and you can see the nursing care for this patient. So since the patient is having a more amount of urine expulsion, so definitely the patient will have a dehydration problem. So we need to assist the patient always. We need to assist the patient's vital signs because a patient may show some shock symptoms like tachycardia and decreased BP. So we have to maintain the vital signs for every 2 hours, and we have to monitor the fluids. So how much amount of fluid intake and output chart should be maintained very strictly, and we have to replace the fluids because the patient may go into a hypovolemic shock. So we have to replace a certain amount of IV fluids according to the doctor's order. And the neurological status, that is we have to see the neurological examination, the classical coma scale we have to maintain, and the mucous membrane we have to give a proper skin care for the patient because the patient will have a dehydration problem. So I think so far we have discussed about